Obesity causes lots of problems on your health. You typically qualify for weight loss surgery if you have body mass index more than 35 with significant health problems such as hypertension, diabetes, and sleep apnea. Today, let's talk about it. 1. Sleeve gastrectomy. It is usually performed laparoscopically. The surgeon removes approximately 75% of the stomach, creating a tubular stomach or sleeve. Sleeve gastrectomy induces rapid and effective weight loss up to 60% of their excess weight. Most people lose up to 60% of their excess weight. Sleeve gastrectomy is less invasive compared to Roux-En-Y gastric bypass. Sleeve gastrectomy is less complex than RYGB and has a lower micronutrient deficiencies. What are good points of sleeve gastrectomy? Removing a portion of the stomach reduces the body's level of a hormone called ghrelin, as the hunger hormone. Thus, many people find that they are much less hungry after the sleeve gastrectomy. Ghrelin also plays a role in blood sugar metabolism, so people with type 2 diabetes often see an immediate decrease in their need for diabetes after the sleeve gastrectomy. What are weak points of sleeve gastrectomy? The SG will make the stomach a high-pressure organ with a sphincter at both ends. It makes leaks from the cut edge of the stomach. It is more difficult to manage. SG has a much higher incidence of gastroesophageal reflux disease because of its higher pressure nature. 2. Roux-En-Y gastric bypass. One of the most common forms of weight loss surgery in the United States. The RYGB is characterized by a small proximal gastric pouch that is divided and separated from the distal stomach and connected to a roux limb of small bowel that is 75 to 150 centimeters in length. After gastric bypass, swallowed food will go into a small pouch of stomach and then directly into the small intestine, thereby bypassing most of your stomach and the first section of your small intestine. What are good points of the Roux-En-Y gastric bypass? It showed amazing weight loss. It promotes weight loss in two ways, by food restriction and malabsorption. Restriction. Small proximal gastric restricts the amount of food you can eat, making you feel full after eating only a small amount of food. Pouch the upper portion of the stomach from the lower portion. The upper portion is then connected to a limb of the small intestine called the roux limb, the new stomach pouch. Malabsorption. The smaller pouch is connected to a limb of the small intestine. It can bypass the larger part of your stomach and part of your small intestine. The result of the bypass is you absorb fewer calories and nutrients from the food you eat. It can decrease nutrients absorption as well. It has particularly dramatic benefits on glycemic control for patients with type 2 diabetes. What are weak points of Roux-En-Y gastric bypass? It is more invasive. It has higher complication rate than others. The procedure reduces your ability to absorb nutrients and calories. You will need to take vitamin supplements, including a multivitamin, B12, iron, and calcium for the rest of your life, and avoiding sweets and fatty foods. It causes dumping syndrome. If sucrose or fructose moves from your stomach into your small bowel too quickly, it causes nausea, abdominal cramping, and diarrhea. Sleeve gastrectomy and Roux-En-Y gastric bypass had acute complications because of invasive surgery, excessive bleeding, infection, adverse reactions to anesthesia, blood clots, lung or breathing problems, leaks from the cut edge of the stomach. Now we are talking about non-invasive surgery or procedure for weight loss. 3. Adjustable gastric banding. It is the least invasive surgery for weight loss. The procedure involves placing an implant, a soft silicone ring with an expandable balloon in the center, around the top part of the stomach. It effectively creates a two-compartment stomach with a much smaller top part above the band. A person eats enough food only to fill the top part of the stomach. Over time, after the meal, the food passes through the opening of the band into the remainder of the stomach, and digestion occurs normally. Although, short-term complications of surgery are very rare. Long-term complication. Between 15 and 60% of patients need reoperation for implant malposition, erosion, frequent vomiting, or weight loss failure. 4. Gastric balloons. It is non-invasive endoscopic procedure. The intragastric balloon consists of a soft, saline-filled balloon that promotes a feeling of satiety and restriction. An IGB is typically inserted endoscopically and filled with 400 to 700 milliliters of saline, generally for a maximum of 6 months. Gastric balloons are temporary, removable devices that are placed in the stomach by endoscopy and can remain for up to 6 months and are then removed using an endoscope. Benefits of gastric balloons: no medications, no surgery, less expensive than surgical options. Devices are temporary and procedures are reversible. Side effects: immediate side effects such as discomfort, nausea and vomiting, GERD. A deflated balloon can migrate into the small intestine and cause bowel obstruction.